I will now demonstrate adjusting of the joints of the head and face using a balloon-assisted chiropractic adjustment technique. I'll position the patient like with any adjustment. We start with positioning. Like positioning my hands, I'll be positioning the aid to giving the adjustment. She may feel some unusual touching feelings back in there. I'll encourage her to have her hands here, and I'll have her take a breath in and hold her breath. At that time, I will close the valve and release. There's a big one. And pause. I will now demonstrate adjusting the joints of the head and face using a balloon-assisted chiropractic adjustment on the left side. I'll have her take a nice breath in and position the balloon like positioning my hands through any other adjustment. We use the balloon to position there. As she takes a breath in and holds, in and hold, I'll close the valve and squeeze and release and rest. Again, I'm Dr. Stephen Berman. I'm going to be reviewing a paper that I wrote in 1990 titled Skull Dysfunction, subtitled A Skullache Model to Explain Headache and Facial Pain, Birth Molding and Obstetric Trauma, Skull Joint Pathology and the Need for Treatment, and also subtitled Skull Joint Treatment Using a Nasal Balloon Device. This paper was published in part in an article in the Journal of Cranial Mandibular Practice, July 1991, Volume 9, Number 3, starting on page 268. A review of my paper here is by a dentist and a chiropractor, Dr. Curl, who reviews the paper and suggests that even well-trained dentists and chiropractors still lack in always helping as much as they'd like with problems of the head and face, headache and facial pains and jaw problems, that reading this paper might be useful to the reader who wants to try to help more. Your skull is joined from 22 bones that form 67 joints. It's by far the most complicated part of our skeleton. Most people know about the joints between the temporomandibular joint, but there's the temporal occipital joints, the temporal parietal joints, the temporal sphenoid joints. Oftentimes, a problem such as being called a TMJ problem, the temporomandibular joint being involved, well, oftentimes it turns out that it's actually a problem of the joints of the temporal bone surrounding the other parts of the temporal bone where it connects to the occiput, the parietal, and the sphenoid bone. And so that a dental problem may in fact be a chiropractic problem if the misalignment is in the skull. Again, 67 different joints of the skull. Many things trigger off headaches, and a list is here of all the different things, including emotional stress, menstrual cycle and hormonal changes, issues of the sinuses, fevers, congestions, headaches, changes in weather, high blood pressure, problems with the glasses and the squint muscles, issues of the spine and the jaw, even things as rare as tumors and aneurysms present themselves as headache oftentimes as a presenting complaint. Well, all of these have a mechanical stress upon the skull. The worry wrinkle that forms during emotional stress will cause the bones of the skull to be pulled further out of line, causing pains that may not be apparent until the mechanical force of the muscles are applied, then to become headache behind the eye or any number of other places. All of these triggers for headaches create a stress within the skull, either from the inside, from pressure increasing on the inside, or from pressure from the outside, or from torquing misalignments and other problems from the neck and the jaw and other places such as this. So to simplify then how headache forms, we see that many things are triggers, and most of the attention is usually placed to the trigger, but the common pain comes from mechanical stress in the joints, because no matter what the trigger is, the person points to the same place, regardless if they think it's an emotional problem, hormonal problem, eye strain problem. Regardless, the headache is the common denominator, so that all these triggers create mechanical stresses on the skull's joints. The brain, the joints fire off the pain fibers that have been found within them. The brain receives the information, and we perceive head and facial pain. Well, the first injury is in fact our birth injury. It's well accepted that at the time of birth, misalignment occurs, especially of the skull. Sometimes it's called cone head or stork marks, or any number of ways to describe what in fact is a life-threatening injury to the skull that has left misalignments throughout, oftentimes to linger through life. So again, early attention to the problems of the head and face and the skull need to be attended from the very beginning, attended to from the beginning. Treatment of the skull has gone through an evolution of working from the outside. We see here wiggling on the skull. Working from the outside again, here we see thrusting on the skull. But what we realize is that when we thrust from the outside, what we're doing is pushing together what already may have been jammed from birth and on from the outside in. So in the 1920s, this is a picture from the 1940s, but from the 1920s, chiropractors started using finger technique to try to get back to open up the bones and joints of the head and face. But it would always fail because we didn't have the right tool to help the baby, and even with the adult, the finger was too big. So, back in the 1930s, there's a reference as early as 1938 in Denver. Dr. Barber shows pictures in a book of using an aid to replace the finger with a way to more effectively adjust the skull. This is a little pump from a blood pressure cuff. This is a little balloon. Oftentimes we use a finger cut to attach to the pump to create a system by which when this is squeezed, this opens up. With an applicator that we shaped from a small wooden toothpick, we then place the balloon in the nasal passageway, not the sinus. The nasal passageway is placed in the spaces between the bones. The sinus is a hollow within a single bone, and the balloon does not go there. It sits within the nasal passageway, which is highly jointed. When placed there, and an adjustive force is given, just like with an adjustment to the body, but an adjusting force using the hand to express the force through the balloon to the joints of the head and face. Now pushing from the inside out in that line of drive for the first time, we are able to then accomplish true chiropractic adjustments accompanied with the same sounds, the cracking sounds that are oftentimes accompanying other adjustments. They now occur from the head and face when no other technique will allow that to happen. The paper was reviewed, has its references, and I thank you for your attention.